Hello, good afternoon, everybody.
Good morning, sir.
Okay, good morning, everybody. That means you are hearing me. Now I will start the class. Okay, in yesterday's class, we discussed very little things and my hiccup also disturbed the class a lot. Yesterday, what we discussed was mainly about the gonadotropic hormones, FSH and LH. Are you hearing me?
Yes, sir.
Yesterday, we mainly discussed about the gonadotropic hormones, FSH and LH. Okay. What is the nature of FSH and LH? What is the chemical nature? What type of hormones are these?
Glycoproteins.
Okay, these are the glycoprotein hormones. Both the FSH and ALS, they comprise alpha and beta subunits, and alpha subunit is the same, whereas they differ in the beta subunits. Not only FSH and ALS, but also HCG and TSH, they are also the similar type. That means all of them are the glycoprotein hormones, and they all share the common alpha subunit, and the beta subunits are the different. And about the mechanism of action of this gonadotropic hormone, we said that they act through G protein coupled receptors. These gonadotropic hormones, they act through G protein coupled receptors. Actually, most of the not most all the tropic hormones, they act through the second messenger system, and in this FSH and LS gonadotropic hormones, they act through G protein coupled receptors, activating cyclic AMP, and they cause the germ cell development and maturation, as well as steroid hormone biosynthesis. FSH and LH. FSH in human or in females, follicular development and estrogen production, whereas in males, they stimulate the Sertoli cells. After the stimulation of the Sertoli cells, Sertoli cells produce androgen binding protein so that they can bind to the androgen, and the concentration of the androgen is more in that vicinity, in that vicinity of the seminiferous tubules, so spermatogenesis could occur properly. In both the case, in male as well as in the females, inhibin is produced, which has the inhibitory role, which inhibits the pituitary as well as for the secretion of GnRH. And LH in case of male, it induces the Leydig cell for testosterone synthesis, but in case of female, LH acts for the maintenance of corpus luteum and the secretion of progesterone. And mechanism of action of this steroid hormone also we discussed briefly, and that is mechanism of action of this steroid hormone is similar to thyroid and the retinoid hormones, that is they are having the intracellular receptors. And we also discussed about the primary and secondary disorders relating to the sex hormones. Today we'll be mainly focusing on the male sex hormones or the androgens. Okay, let's go. This is our KU syllabus. LH and FSH we discussed in yesterday's class. Today we'll be discussing about the androgens, that is testosterone, and testosterone. We'll be talking about the testosterone. And in this testosterone, we'll be focusing on the synthesis, metabolism, and functions. Okay. Biochemical test of infertility is in the next class after the female hormones. Okay. DHEA, that is dehydroepiandrosterone, androstenedione, and dihydrotestosterone, along with the testosterone as the example of the androgens. And among these, testosterone is the principal androgen produced by the testes. Dehydroepiandrosterone, androstenedione, dihydrotestosterone, and testosterone. These are the example of androgens. Andro means relating to the male, which gives the masculine characteristics. These are the 4 hormones, and among them, the principal hormone is testosterone. Actually, dihydrotestosterone is the active form of testosterone. We'll discuss later on. 4 hormones: dehydroepiandrosterone, androstenedione, dihydrotestosterone, and testosterone. And all these are C19 steroid with OH group in 17th position. You might have studied in the synthesis of the steroid hormones in earlier class, and these male androgens are containing 19 carbons. Okay. We are repeatedly saying that these testicular androgens are synthesized in the interstitial cells by interstitial tissue by the Leydig cells. That means these testicular androgens are synthesized by the Leydig cells. Much amount of the androgens is synthesized by the Leydig cell. However, little amount is also secreted by the extra testicular cells also. As you have studied in the synthesis of adrenal steroid, this is also found in the adrenal cortex. Very little amount. Androstenedione, up to this stage of androstenedione, it is also found in the adrenal cortex, and after this stage, only after the puberty, the following stages will be formed. Testosterone is eventually converted into more active hormone, dihydrotestosterone, in the target tissues. Don't get confused with the testosterone and the dihydrotestosterone. Actually, dihydrotestosterone is the active, you can say, the active form of the testosterone. In the target tissues, when the testosterone enters the target tissues, that is converted to dihydrotestosterone. Okay, that is little information. We were saying that this testosterone is synthesized by the Leydig cells in the interstitial tissue. These Leydig cells are almost non-existent in the testes during childhood, and the testes secrete almost no testosterone in the childhood. But these Leydig cells are numerous in the entire period of fetal development and newborn male infant for the first few months. And in for the first few months, and in the later days, that is in the puberty, which starts around 10 to 13 years and up to the 50 years, their concentration is very high. And after this, again, the concentration of this testosterone or other forms, they will decrease. We are repeatedly saying about the testosterone because testosterone is the major form, and this dihydrotestosterone is the form which is formed in the tissues, which is more active than the Leydig cells are almost non-existent in the testes during almost non-existent means they will not secrete testosterone, but they are numerous. Okay, it is interesting to know that they are numerous in the entire period of fetal development, and in the fetal development also this testosterone has a role, and in the newborn also for few weeks this testosterone is there. After that there will be no role, and only after 10 to 13 years they will be start synthesizing, and again later on the synthesis will decrease. Okay, The term androgen also includes the male sex hormone produced elsewhere in the body beside the testes, because not only in the testes, steroid hormone is synthesized elsewhere in the body also, and those hormones are also known as we have seen the adrenal cortex. Example, the adrenal cortex. Also, the tumor of the adrenal producing cells. In the case of the tumor of adrenal androgen producing cells, the quantity of androgen may become so great that their effect might be seen even in the female. That means even in the females, in the case of adrenal androgen producing cells, male characteristic will be seen. That means if there is a tumor in the adrenal androgen producing cells in the female, that means this androgens will be synthesized in high quantity, and this is some of the masculine characteristics. Okay, all androgens are steroid compounds, as we already know. This is C19 compound. Both in the testes and in the adrenals, the androgens can be synthesized either from cholesterol or directly from acetyl coenzyme. You have synthesized the adrenal steroids in your previous classes, isn't it, from the cholesterol? And cholesterol is ultimately formed from the acetyl coenzyme. That means these androgens, they can be formed from the cholesterol or directly from the acetyl coenzyme. And just to remind you about this structure, this is this is the testosterone. This is the pregnant ring, because after the cholesterol, in the steroid hormone biosynthesis, we have studied about cholesterol converted to pregnenolone, isn't it? Pregnenolone, that is the OH group is added there. This is simply the pregnant ring. This just to compare the pregnant ring with the testosterone, I have shown you here. This testosterone consists of how many carbons? Just let's count. Okay, A, B, C, D. These 4 rings consisting of the 17 carbons. One carbon here. This is the 18th position, and this is the 19th position. Okay, there are 19 carbon. That's why testosterone or other androgens are C19 carbons. This is the pregnant ring. Okay. That is the pregnant ring, isn't it? This is the testosterone. Mind you, this is the Gonen ring. This Gonen ring, you have said that all the steroid consist of the steroid nucleus, that is cyclopentanoporhydrophenanthrin. That cyclopentanoporhydrophenanthrin is also known as the Gonen ring. This is the cyclopentano, and all hydrated, this 3 ring is the phenanthrin ring. Cyclopentano for hydrophenanthrin and Gonen. Okay, this is the same thing. Okay. Spend 18 carbon atoms. We'll talk about the estrogens in our next class. Today we are talking about the androgens. These are 19 carbon atoms. That means one CH3 in this position and that CH3 in this position here. 19 carbon. Okay. If you remember about the pregnant, 21 carbon is cholesterol, 27 carbon. Okay. In bile salts, 24 carbon. The conversion of cholesterol to pregnenolone is identical in the adrenal, ovary, and the testes, because in the case of adrenal, you have already studied, and the conversion of cholesterol to pregnenolone is identical. That means the same side chain cleaving enzyme will function in the testes and ovaries also, but in the later 2 tissues. That means in the ovaries and testes, this is with the help of LH, luteinizing hormone. But in the case of adrenal, this was activated by the ACTH. And this first step occurs in the mitochondria. Now the other steps for androgen synthesis, they will occur in the microsomes. During the study of synthesis of adrenal steroid hormones, we have studied like some of the steps will occur in the mitochondria, again in the microsome, again in the mitochondria. That means they will reshuffle. But now here the steps are simpler. This first step will occur in the mitochondria, and now the other steps will occur in the microsomes, that is the endoplasmic reticulum. The conversion to cholesterol from cholesterol to pregnenolone is identical in the ovary and testes also, as you have studied in the case of adrenals. And it was also involving the star protein, steroidogenic acute regulatory protein, for the transfer of cholesterol from the cytosol to the mitochondria, and after that, with the help of side chain cleavage enzyme, pregnenolone was synthesized. Here also the same thing. And after this first step, which occurs in the mitochondria, other steps will occur in the endoplasmic reticulum, that is in the microsomes. Okay, let's see how easy are the steps. They are not that difficult. Okay, cholesterol. With the help of side chain cleavage enzyme, this is P450, cytochrome P450 dependent enzyme, side chain cleaving enzyme, pregnenolone is formed. And this is the same step as you have studied in the adrenal steroids. Now, after the formation of this pregnenolone, there are two pathways. One on this left side and other on this right side, and this is also known as the progesterone pathway. That means after the formation of progesterone, testosterone will be formed later. Okay. Cholesterol is first converted to pregnenolone, as we have studied in the case of adrenal steroids also. This is with the help of cytochrome P450 dependent side chain cleavage enzyme, pregnenolone. Cholesterol, just we have seen 27 carbons, now pregnenolone 21 carbons. Now from this pregnenolone, with the help of 17 alpha hydroxylase, pregnenolone is converted to 17 alpha hydroxypregnenolone. Very easy. Pregnenolone with the help of 17 alpha hydroxylase, that is on the 17th position where it is added this 17 alpha hydroxypregnenolone. Now 17 alpha hydroxypregnenolone. Now with the help of C1720 lyase, that means two carbon are now lost, resulting in the formation of dehydroepiandrosterone. Dehydroepiandrosterone, these two carbons are lost, which are the side chains C17 and 20, both are lost now. Now dehydroepiandrosterone is formed. And after this dehydroepiandrosterone, with the help of 17 beta hydroxysteroid dehydrogenase, now androstenediol is formed. Now this androstenediol with the help of enzyme 3 beta hydroxysteroid dehydrogenase, 3 beta hydroxysteroid dehydrogenase and delt 5,4 isomerase testosterone is formed from this pathway. These are all these arrows, the same enzyme. This is one protein having two enzyme activities, that is 3 beta hydroxysteroid dehydrogenase and 5,4 isomerase. These two, both these enzymes are present on the same protein. Here also 17 alpha hydroxylase and C1720 lyase. This is also the example of multifunctional enzyme. It is present on the same protein. Okay, here pregnenolone. This pregnenolone is converted with the help of this enzyme 3 beta hydroxysteroid dehydrogenase and 5,4 isomerase to form progesterone. And this progesterone with the help of the same enzyme, okay, in this side also the enzymes are the same. 17 alpha hydroxylase, it will form 17 alpha hydroxyprogesterone. After this, with the help of C1720 lyase, androstenedione. After this androstenedione, with the help of 17 beta hydroxysteroid dehydrogenase, testosterone will be formed. These are the steps by which the testosterone is synthesized. Okay. The synthesis of testosterone can take place from the cholesterol or from the acetyl coenzyme from. And the conversion of this cholesterol to pregnenolone, this occurs in the mitochondria. Now the other steps occur in the microsomes of the endoplasmic reticulum. This 3 beta hydroxysteroid dehydrogenase and 5,4 isomerase, these two activities are present on the same enzyme. That is, this is also the example of bifunctional enzyme. These two enzymes, 17 alpha hydroxylase as well as C1720 lyase, are also present on the same protein. This is also the example of multifunctional enzyme. Okay. In this way, testosterone is synthesized. Now we'll talk about the metabolism of testosterone. After the secretion by the testes, About 97% of the testosterone is either loosely bound with the plasma albumin or more tightly bound with the sex hormone binding globulin. That means after secretion, this can bind either with the albumin or with the sex hormone binding globulin, and their proportion varies with the male and female, and with the age also their proportion varies. But the truth is, the binding with the plasma albumin is loose, whereas the binding with the sex hormone binding globulin is tight. And this circulates in the blood in this state for 30 minutes to several hours. By that time, the testosterone is either transferred to the tissues. Testosterone is transferred to the tissues where they do their function, just like in the prostate, or degraded into inactive products that are subsequently cleared. That means most of the testosterone circulate in the bound form, either with the plasma albumin or with the sex hormone binding globulin, and the total bound form is around 97%. Okay, let's see this. The androgens in the body. Okay, because androgens, little amount of androgens, they are also present in the females. That's why I have shown here. And in the females, the bound form with the sex hormone binding globulin is more, so that the loosely bound with the albumin would be less. Loosely bound means there is more chance that this loosely bound testosterone will be unbound or free, and which is the active form of the testosterone. That is, the free testosterone is the unbound testosterone, which is freely available. And this bioavailable is unbound plus albumin bound, because this is loosely bound, and it can easily dissociate with the albumin. Metabolism of testosterone after the secretion by the testes, about 97% will be in the bound form, and that bound form, if bound with the albumin, means it is loosely bound, but it is tightly bound with sex hormone binding globulin, and circulate in the blood for at least 30 minutes to several hours, and after that they either enter into the target tissues or they are inactivated and excreted, especially by the help of liver. We'll see the substitutions. Most of the testosterone that becomes fixed to the tissues, that means that enters the target tissues, is converted within the tissues to dihydrotestosterone. This occurs especially in the prostate gland in the adult, and organs such as the external genitalia of the male fetus. That means it is converted to dihydrotestosterone in the target cells. This is the testosterone. Testosterone with the help of 5-alpha reductase utilizing NADPS, it is converted to dihydrotestosterone. In this form, dihydrotestosterone, this double bond is is reduced. You can see that there is no double bond. This double bond is reduced here. This is, let's say, one hydrogen will attach here and the other hydrogen will attach here. These hydrogens are not shown in this picture, and this is dihydrotestosterone. Much of the testosterone that becomes fixed to the tissues, that enter the target tissues, it converted within the tissue cells to dihydrotestosterone, which is also regarded as the active form of more active form of testosterone. Actually, testosterone itself is not the inactive form, but dihydrotestosterone is very much active than testosterone. It occurs in the prostate gland in the adult and also in the external genitalia of the male fetus. These are the best examples. Because in the fetus, this testosterone is the major hormone which help in the development of the male sex characteristics. And okay, this is the same picture I have shown. Now, degradation and excretion of testosterone. The testosterone that does not become fixed to the tissues is rapidly converted mainly by the liver into androsterone and dehydroepiandrosterone. This androsterone and dehydroepiandrosterone, they are converted mainly by the liver to androsterone and dehydroepiandrosterone. We have said that testosterone, dihydrotestosterone, dehydro-EP. Okay, they were the major forms, and during this degradation and excretion process, liver converts the testosterone into androsterone and dehydro-EP androsterone, and simultaneously conjugated as either glucuronides or sulfates or glucuronide sulfates, and they are excreted in the bile into the gut. Okay. The testosterone that does not get fixed to the tissues is rapidly converted, mainly in the liver, into androsterone and dehydroepiandrosterone. And this androsterone and dehydroepiandrosterone, these are conjugated either with glucuronide or sulfates, or even glucuronide sulfate. And these substances are excreted either into the gut by the way of the liver, in the bile, or into the urine through the kidneys. Okay, relative activity of androgens. This is the relative activity. If we consider the activity of testosterone as 100, dihydrotestosterone activity is 300 times. That means three times more. And this is only 10 times, means only 10%. This is only 5% activity of testosterone. Dihydrotestosterone, testosterone, androstenedione, and dehydroepiandrosterone. These are the four major forms of androgens, and the most active is dihydrotestosterone. When you compare it with testosterone, it has 300 times more activity. If you consider it as the 100, that means 3 times. And this androstenedione and DHA, they have the less activity. Now the regulation of testosterone synthesis. This we have seen in yesterday's class also. Okay. Gonadotropin releasing hormone stimulates the pituitary for the synthesis of LH and FSH. This LH will act on the Sertoli cells for the synthesis of androgen binding protein, and this androgen binding proteins will bind with the androgens, and when it binds with the androgen, the concentration of that androgen in that vicinity of the seminiferous tubule would be very high, so that it favors the environment for the formation of spermatozoa. And it also secretes other factors which help for spermatogenesis. And next is LH stimulates the Leydig cell for the synthesis of testosterone, which we have been discussing. Okay. Now there will be the negative feedback inhibition with the help of inhibin, testosterone, dihydrotestosterone, and even with the estradiol, because this testosterone, which is formed in the Leydig cell, it is converted by the help of aromatase into estradiol in the Sertoli cells. This is also inhibit the pituitary. This is about the regulation. Now the actions of testosterone and actions of testosterone and dihydrotestosterone. Why we are saying only testosterone and dihydrotestosterone? Because their activity is very much higher than the activities of other two forms. That is dihydroepiandrosterone and androstenedione. Okay. Test. We are seeing what the test is. Okay. This is the testosterone released and into the target cell with the help of 5-alpha reductase. It is converted to dihydrotestosterone. It is bound with the cytoplasmic receptors, and with that it is entering into the nucleus, and in the nucleus it combines with the hormone response element HRE and influence transcription and translation, and which influences number of activities like gonadotropin regulation, spermatogenesis, sexual differentiation, like Wolfram stimulation, external virilization, and also sexual maturity at puberty. Now, these are just the brief points. Now we will go point wise. Okay, functions. We'll go to the functions now point wise. Functions of the testosterone during fetal development. Testosterone begins to be elaborated or formed by the male fetus testis at about the 7th week of embryonic life, and this is with the help of testosterone that causes the testes to descend into the scrotum during the last 2 to 3 months of gestation. And that means this testosterone is even produced in the fetal life. Just I start producing it 7th week of embryonic life, and the descent of the testes into the scrotum is due to the activity of this testosterone. Effect of testosterone on development of adult primary. Effect of testosterone on development of adult primary and secondary sexual characteristics, and that you all know. After puberty, and we have said that during birth, the level of testosterone is still higher in the case of male babies, but for around 10 to 12 years, there will be no production because the Leydig cells are almost non-existing. And after puberty, increasing amount of testosterone secretion causes the penis, scrotum, and the testes to enlarge many folds, especially before the age of 20 years. After 10 to 13 years to 20 years. Okay, now we'll go to the biological effects of testosterone. We are seeing testosterone and dihydrotestosterone because they have the high activity in comparison to the other ones. Okay, growth of genitals in a boy, very clear. Production of sperm. Growth of facial, pubic, and axillary hairs. Nitrogen retaining effect. Muscular development, especially due to the increased muscle and protein synthesis. And growth of larynx and the deepening of voice is also due to the testosterone. Growth of larynx you can see in males, large growth in males. This is due to the testosterone. Growth of larynx and the deepening of voice, and also causes early epiphyseal closure of the bone slightly earlier due to the high concentration of testosterone. Behavioral changes in men, just like the aggressiveness. This is not the fault of the man. This is actually due to the testosterone. And also, this testosterone induces male type baldness. If the concentration of testosterone is high, that means there is chance that you will have baldness in the later age. Also, thickening of the skin and the loss of subcutaneous fat. This is also the action of testosterone. Thickening of skin and the loss of subcutaneous fat. This thickening of the skin is especially due to the synthesis of proteins, and there is the loss of subcutaneous fat. There is an increase in the basal metabolic rate. That means in the experimental animals, if we inject the testosterone, then the metabolic rate is found to increase by much as around 15%. And also there is increase in sebaceous gland due to this testosterone, and due to the increase of testosterone during puberty, there is the increase in the sebaceous glands, which often causes acne. Increase in the sebaceous gland due to the testosterone. Testosterone levels is high during puberty, so there is the acne formation in this time. Next is erythropoietin secretion is also increased. There is also testosterone also increases erythropoietin secretion. Others, it also affects the pelvis to narrow the pelvic outlet, lengthen it, cause a funnel-like shape instead of the broad ovoid shape of the female pelvis, and they greatly increase the strength of the entire pelvic for load bearing because the male are slightly stronger to bear the larger load also, isn't it? This is also about this pelvis. This is the testosterone. Effect on the pelvis to narrow the pelvic outlet, to lengthen it, cause a funnel-like shape instead of the broad or wide shape of the female pelvis, greatly increase the strength of the entire pelvis for load bearing. These are the functions of the testosterone. Okay, we discussed mainly about the synthesis and functions of androgens, and the most active androgen is dihydrotestosterone, and the principal androgen is testosterone, and the effects biological role of testosterone we discussed. And now we'll go to some of the MCQs before ending the today's class. Okay. Gonadotropin releasing hormone. What type of hormone is this? Either this is a tripeptide, decapeptide. It is a peptide with 41 amino acids, peptide with varying 37 to 45 amino acid. Okay. Gonadotropin releasing hormone is what type of hormone do you think is the gonadotropin releasing hormone? Anyone? Gonadotropin releasing hormone. What type of hormone is it? Hello, are you hearing me?
Polypeptide.
Okay, that means somebody spoke means you are hearing me. Okay, what is the answer? Gonadotropin releasing hormone is tripeptide, decapeptide, or it consists of 41 amino acids or varying amount of amino acids. What is the correct answer? Gonadotropin releasing hormone is are you listening to me?
Decapeptide.
Okay. Decapeptide. Now we'll move to the next question. Gonadotropin hormone releasing hormone mediates its action by cyclic AMP, cyclic GMP, calcium, or tyrosine kinase. What is the second messenger of gonadotropin hormone releasing hormone?
Cyclic AMP.
Here, cyclic AMP are about the tropic hormones, isn't it? They're the stimulating hormone, just like FSH, ELS, thyroid stimulating hormone. They use cyclic AMP. But the hypothalamus hormones like gonadotropin releasing hormone, thyroid releasing hormone, they use
Calcium.
the second messenger, calcium. Okay. Releasing hormones like gonadotropin releasing hormone, thyroid releasing hormone, they use the second messenger, calcium. And cyclic AMP was used by the tropic hormones like LH, FSH. Yes, LH, FSH. Now next. In the circulation, approximate percentage of testosterone that is in the bound form, either with the albumin or with sex hormone binding globulin is, what is the percentage of the bound form? 10%, 50%, 97%, 30%. What is the approximate percent?
97%.
97%.
That we have discussed in today's class. Now we'll go to next MCQ. Only this. Another also might be in the next slide. Okay, this much for today. If you have questions regarding today's class, okay, unmute your mic and discuss. In the next class, reading about the female sex hormones. We will study female sex hormones in the next class. After that, tests done in infertility. Okay, this is most important for the biochemistry and this pathway. Synthesis of testosterone. No question at all? Okay, then come reading, we'll discuss the next day. I come with questions, but I will also have to find out for your answer, so that I'll also go to the books, internet, and I'll also gain more knowledge. Okay, this much for today. Okay, thank you, guys.